Namaste. In this video, we are going to discuss the comparative consideration of Sandhi Sharira. The following are the learning outcomes of this presentation: introduction, derivation, definition, classification, and biodynamics. Introduction. In general, the joint is a site where two things join with each other. However, in anatomy, the joint is a junction between two or more bone or cartilages, which is derived from a Greek word arthron, from which we have terms like arthrology, arthritis, etc., and from a Latin word articulatio, from which we have terms like articulation. As per Ayurveda, it is derived from samadhatu, joining with the dha ki pratyaya, which means sandhanam, the meaning of which is union. To Nirukti, in Amarakosha, we get a shloka, Sandhi, Sandhanam, which means the site where there is a joining between two structures is known as Sandhi, whereas Sharangadara Purvakanda says, Sandhayashcha Anga Sandhanam Dihe Prokta Kapanta. They are the site where Kapha is present and the two Angas, the body parts, are joining with each other. Charaka Samhita gives a proper specific definition for this Sandhi. It says, Asti Sanyogastanam Sandhi. The site where the asthis are connecting with each other is known as the Sandhi. Coming to the Sankhya, as per Sushruta, there are 210 in number. Sankhya Tastu Dashottara Dveshati. Whereas Ashtanga Hridayakara says Sahasre Dve Nijagatre Nandana. There are 2000 Sandhis are there. And this is the opinion Ashtanga Hridayakara is giving of that of the Atreya. Whereas Kashyapa says Treni Sandhi Shatani Eka Ashita. There are 380 Sandhis are present in the body. Whereas Sushruta clarifies his opinion that Astam tu Sandhayo Keta Kevala Parikirtata Peshisnayasare Kiranam tu Sandhi Sankhya Navidyate. So whatever 210 Sandhis have been mentioned is that of the Sandhi between the Asti. There are many more Sandhis between the Peshis, Nayasira, and that number is not specified here. Into the distribution of the Sandhi, in the Shaka, there are 17 Sandhis are there in each Shaka, making them 68 in all four. Madhya Sharira, there are 59 Sandhis, and Chatururdhva, head and neck region, there are 83 Sandhis are there. Distribution. In each Anguli, there are 3 Sandhi, except in the Angushta, which have 2, making a total of 14 Sandhi in the Angulis. Janu, Gulpa, Vamshana, 1 each. So, in a total, in each Shaka, there are 17 Sandhis. So, making them a total of 68 in 4 Shaka. Shroni Palaka, there are 3 Sandhis. Prishtavamsha, there are 24. Parshva, 24 Sandhis. Vaksha region, there are 8 Sandhis. In the Griva, there are 8 Sandhis. In the Kantha, there are 3 Sandhis. And Hridayanadi or Klomanadi, there are 18 Sandhis. There are 32 Dantamulas, 1 at the Kakalaka, 1 in the Nasa, 2 related to the Vartma Mandala, 2 in relation to the Ganda, and 4 in relation to the Karna and Shankha. 2 Sandhis in the Hanu, 2 above the Bhru, 2 above the Shankha, and in the Shirakapala there are 5 Sandhi, and Murtha there is 1 Sandhi. Coming to the classification of the Sandhi. In Ayurveda, Sandhi are classified based on their function, that is Karmatmaka Vargikarana, and Rachanatmaka Vargikarana, that is the classification based on the structure. Now let me discuss on Karmatmaka Vargikarana. Based on karma, the Sandhi are of two types, Cheshtavanta Sandhi and the Sthira Sandhi. The Cheshtavanta Sandhi, they are also known as the Chala Sandhi. Again, based on the degree of the mobility, they can be of two types, Bahucheshta and Alpacheshta. Some of the examples we get in the Sushruta Sharira, where he says, Shakastu Hannu Katyamcha Cheshtavantastu Sandhya. In the Shaka, in the Hanu, in the Kati, we can find the Cheshtavanta Sandhi. We can make it out here. The Shaka, Hanu, they can be the Bahucheshta Sandhi, whereas Kati is a Alpacheshta Sandhi. The second variety, that is the Sthira Sandhi. Sthira Sandhi are also known as the Achala Sandhi. Sushruta says, Sheshastu Sarva Vijnaya Sthirapadehi. So, remaining whatever Sandhi which do not have mobility, they can be considered under the Achala Sandhi. If we see the contemporary anatomy, in contemporary anatomy also, the joints are classified based on their function and their structure. Based on the function, these joint can be of three types based on their degree of mobility: synarthrosis, amphiarthrosis, and diarthrosis. The synarthrosis are immovable joints like cranial sutures. Amphiarthrosis, the joints which have slight degree of mobility, like secondary cartilaginous joint. Whereas diarthrosis, the joints which are freely mobile, like shoulder joint. If we see the Ayurvedic aspect, the based on the structure, the there is Rachanatmaka Vargikarana. Based on the structure, the Acharya have classified, Sushruta have classified the Sandhi into 8 types. Like they are Kora Sandhi, Ulukala Sandhi, Samudka Sandhi, Pratara Sandhi, Tunna Sevani, Vayasatunda, Mandala, and Shankava. We'll be discussing one by one. First, coming to the Kora Sandhi. The Kora has synonyms like Garta and Kalika, whereas Bhava Mishra says Garta and Nalika. So, in Sushruta Sharira, Dallana comments that Koro Nama Garta Tadakrataya Kora, Kora Kalika Tadakrataya Ityani. So, whereas Bhavaprakasha says Nalika Ityani. The Sandhi, here we can see, have the structure articulating surface, which is either a Garta shape, there is a small depression, or Kalika, there is a slightly convex. So we can say that there is a concave or convex surface which are articulating, making the core Sandhi. These are the distribution of the core Sandhi. They include Anguli, Manibandha, Gulpa, Janu, Kurpara. So these are the examples for the core Sandhi. Again, in Pratyaksha Sharira, we get reference regarding the types of the core Sandhi. It says Kalla Kora, Paraspara Kora, Chakra Kora, and Sandamsha Kora. Kalla Kora, they are the pestal motor joint which are present in the wrist and ankle. Paraspara Kora, saddle joint, metacarpophalangeal joint. Chakra Kora, a pivot atlantoaxial joint. Sandamsha Kora, a hinge joint like elbow. The second variety is the Ulukala Sandhi. So, Ulukala refers to a mortar which is used to crush the grain. Here, the spherical articular surface of one bone fits into the socket like articular surface in the other one, like the mortar and pestle. The examples are given like Kaksha, Vangshan, and Dashana are the examples for the Ulukala Sandhi. The third variety, the Samudga Sandhi. This variety of Sandhi looks like a box where a flat surface of one bone articulates with the flat articular surface of the another bone. It can be correlated to the plane articular surface in the articulation. So examples are given like Amsapita Guda Bhaga Nitambeshu, Samudra, Amsapita, Guda, Bhaga, and Nitamba are the site where the such variety of the joint can be seen. Pratara Sandhi. Dhalana says this Prataratyane Prataro Bhelakaha Tadakritaya Pratara. So Bhelaka refers to as sailing boat. The sandhi which has the structure and function similar to that of the velaka or velaka is known as the pratara sandhi. Velaka refers to raft or sailing boat. Examples are given like Griva Prishhtavamshayoha pratara. In the Griva Vamsha and in the Prishhtavamsha we can see the pratara sandhi. So we can say here the intervertebral joint. The next sandhi is the Tunna Sevani sandhi. The word Tunna Sevani is found by union of two words. Tunna Sevani. Tunna refers to the cloth, whereas Sevani refers to the stitches. The Sandhi which appears like stitches, hence the name. Here, Paraspara Pidanaihi Tanturadharadibir Kapalantarala Sandhaya. So these Sandhis are specifically seen where the Kapala Asthis are joining with each other. The Asthis will have a Tanturadhara, that is, they have a denticulate or a serrate margin, which fit into each other to make the Sandhi. Sushruta gives the example that Shirakatikapaleshu Tunasevanya. That is, these are present in the Shirakapala and the Katikapala. The Shirakapaleshu Drishya, Katikapaleshu Pragyavvanata. So the sandhis which are present in the Shirakapala can be seen at any age of at any age, whereas the sandhi which are present in the Katikapala can be seen until the puberty. The next sandhi is the Vayasudanda sandhi. The Vayasa refers to crow, whereas Dunda refers to the beak. The articulating asthi appears like beak of a crow, hence the name Vayasatunda Sandhi. The Vayasatunda Sandhi is also known as the Kakatunda or Kakamukha as per the Bhava Prakasha. And these are the Sandhi. The example for the Vayasatunda Sandhi is the Hanu Sandhi, where the articulating part of the mandible appears like the crow beak, hence the name Vayasatunda Sandhi. The next variety of the Sandhi is the Mandala Sandhi. Mandalakriti. The Mandala Sandhi have the shape similar to that of a mandala, and Bhavaprakasha says Mandalam Prasiddham. So it is very famously known structure of that time. So these are some examples of the mandala. So where the circular asti fits into another circular asti, making the Sandhi. Some of the examples which are given for the mandala sandhi are like Kantahridaya, Netra, Klomanadishu, Mandala. So these are specifically seen in the nadis, and he gives the list like Kanta Nadi, Hridaya Nadi, Netra Nadi, and Klomanadi. Hridaya you can see here, circular ring is there, so that can be considered here. Then Netra Nadi, this circular ring. Again, Kantanadi, Klomanadi can be seen here. So these cartilaginous structures in these organs can be considered under the mandala sandhi. The last variety of the sandhi is the Shankavarta sandhi. Shankavartaha Shankabramaha. So the sandhi which appears like that of the uh, Avarta whirl of the Shankha. So this similar structure can be considered as the Shankavarta sandhi. And the examples are given like Shrotra Shrangatakeshu Shankavartaha. So these are present in the Shrotra and in the Shrangataka. So we can correlate them to the cochlea. Now let us see the structural classification as per the modern contemporary anatomy. Based on the type of the connecting structure between the articulating bone, the joint are of three types. They are fibrous joint, where the connecting structure is the fibrous connective tissue; cartilaginous joint, where a cartilage connects the two bones; the synovial joint, where there is a synovial membrane and a synovial fluid. Fibrous joint. In this joint, the fibrous connective tissue connects the adjacent bone. These joints are either immovable or may produce very slight degree of the movement. There are three types of the fibrous joint: sutures, syndesmosis, and the gomphosis. Let us discuss the first variety, the sutural joints. Based on the shape of the bone end which are making the joint, the sutures can be of five varieties. They are serrate suture, dentate suture, squamous suture, limbus suture, and plain suture. And there is one more variety that is called as the scandalysis. We'll see one by one. First, coming to the sutura serrata or serrate suture. In this variety, the articulating bone will have a serrate margin, giving appearance of a saw edge. The example for the serrate suture is the sagittal suture. The second variety of the suture is the sutura denticulata or dentate suture. In this, there is a tooth-like process which is narrow, which has a narrow process and a broad end, which fit into each other. The tooth-like process of the two bone fit each other to make the suture. The articulation between the mastoid part of the temporal bone and the occipital bone are the best examples for the dentate suture. The next variety of the suture is the squamous suture or sutura squamosa. The bone articulate by a beveled margin. You can just observe here. So they have a beveled margin which overlap each other. The example is the squamous part of the temporal bone and the parietal bone. So sutura limbosa. It is similar to that of the squamous suture. The only difference is the overlapping margin are rigid, whereas in the squamous suture the margins are flat, whereas here they are rigid. The example is the suture between the parietal and frontal bone, the coronal suture, the variety of the limbus suture. Sutura plana, also known as the sutura harmonia. The sutura plana is a suture where there is a simple apposition between the two articulating bones. The adjoining articular surfaces are flat. The example is the horizontal plate of the palatine bone and palatal plate of the maxilla. And there is a suture between the horizontal plate of the right and left palatine bone. So all these are the examples for the plain suture. There is a special kind of suture called as the scandalysis, also known as the wedge and groove joint. A bony wedge fit into a groove of another bone. You can just observe this is the sphenoid bone, and below there is body of the sphenoid bone, and this is the schematic representation of the body of the sphenoid bone and the underlying femur. On the inferior surface of the body of the sphenoid bone, there is a ridge in its median plane. Now that ridge is known as the rostrum. The rostrum of the sphenoid bone fits into a groove in the upper margin of the femur, which is known as the ala of the femur. So, ridge, that is rostrum of the sphenoid, fits into groove in the ala of femur. That is and they are connected by means of a ligament called as the sutural ligament. Now, such joint where a ridge or a wedge fits into a groove is known as the scandalysis. So, these are the varieties of the sutures which are present in the body. So, that makes the first variety of the joint, that is fibrous. First variety of the fibrous joint, that is sutures. Syndesmosis is the second variety of the fibrous joint. The syndesmosis are those joints where the articulating bone are joined directly by an interosseous ligament or a fibrous cord or an aponeurotic membrane. Usually, the syndesmosis allow a small amount of the movement. The best example for the syndesmosis are like tibiofibular syndesmosis that we can see here. The fibula and tibia, they are connected by means of a interosseous membrane. Similarly, the lower end of the tibia and fibula, they are connected by means of a ligament called as the anterior interosseous tibiofibular ligament. Similarly, there are the syndesmosis between the radius and ulna to making the middle radial nerve joint. So these are the examples for the syndesmosis. The third variety of the fibrous joint is the comphosis. In this, a bony component are adapted to each other like a peg in a hole. So the peg-like process of one bone fits into a hole or a depression in the another bone to making the comphosis. The comphosis in our body is present in relation to the teeth and its socket. The tooth and sockets of either maxilla and mandible are the examples for the comphosis. The sockets in the mandible are maxilla and root of the tooth being connected by the ligaments which are known as the periodontal ligaments, which contain gingival fiber, horizontal fibers, which are also known as the fibers of sharp pain. After finishing the first variety of the joint, that is fibrous joint, now let us discuss regarding the second variety, that is the cartilaginous joint. The cartilaginous joint are those in which the adjacent bone are connected by means of a hyaline cartilage or a fibrocartilage. Primarily based on the type of cartilage which connect, there are of two types: primary cartilaginous joint, which is also known as the synchondrosis, and secondary cartilaginous joint, which is known as the symphysis. The first variety of the cartilaginous joint, that is primary cartilaginous joint, also known as the synchondrosis. In this, the bones are united by means of a hyaline cartilage. In this image, you can see there is a hyaline cartilage connecting the two bones. Such joints are immovable, but they are strong. Even though they are strong, they are temporary, as after certain age, the cartilaginous plate get ossified and replaced by the bone, and these are seen in a growing bone. In a growing bone, there will be epiphysis and the diaphysis. Between the epiphysis and diaphysis, there is a cartilaginous plate, which is known as the epiphyseal plate, which is made up of hyaline cartilage. And as the bone grows in length, this epiphyseal plate disappears and get converted into bony structure. Now, such joint where the epiphysis and diaphysis connected by means of a hyaline cartilage is considered as the primary cartilaginous joint. Now, let us see the clinical correlation of the primary cartilaginous joint. Injury to the epiphyseal plate, especially at the bone's growing end, after a long bone fracture in a child, can result in shortening in the length of the bone. The second variety of the cartilaginous joint is the secondary cartilaginous joint, also known as the symphysis. The articular surface are covered by means of a thin layer of the hyaline cartilage and lined by a disc of the fibrocartilage. So here it is different from the primary cartilaginous joint in that way. So in the primary cartilaginous joint, the two bones are connected by means of a hyaline cartilage, whereas here there lies a fibrous cartilage in between the two layers of the hyaline cartilage. These joints are permanent and persist throughout the life. So contrary to the primary cartilaginous joint, which is temporary, the secondary cartilaginous joint are permanent and they permit some degree of the movement due to elastic fibrocartilage. The examples are like the symphysis pubis, the intervertebral joint between the vertebral bodies. And usually these secondary cartilaginous joints are present in the median plane of the body, whereas primary cartilaginous joints are present in the limbs. Now let us start with the third variety of the joint, that is synovial joint. We have finished with the fibrous joint and cartilaginous joint. The synovial joint is the most common and most evolved variety of the joint, the maximum degree of mobility. The articular surface of the adjacent bone are separated by a cavity, and margins of the articular surface are connected by the capsular ligament. So this makes the specific feature of the synovial joint. So there will be a cavity in between the two articulating bones, and the bones are connected by means of the articular capsule or capsular ligament. Classification of the synovial joint. The synovial joints are classified based on the plane of the movement, based on the shape of the articular surface, and based on the number of articulating bones. Based on the plane of the movement, the synovial joint can be of three types. They are uniaxial joint, the biaxial joint, and multiaxial joint. Uniaxial joint, where the joint moves around a single axis. Example like elbow joint, interphalangeal joint, atlantoaxial joint. In all these joints, they produce one variety of momentum. The biaxial joint, where there will be two axes and the joint move around the two axes, like knee joint, radioulnar joint, radiocarpal joint, sternoclavicular joint. Whereas multi-axial joint, where the multiple axes are present and around which the joint moves, like shoulder joint, hip joint. Again, based on the shape of the articular surface, the joints are classified into following: the plane joint, hinge joint, pivot joint, condylar joint, ellipsoid joint, saddle joint, and ball and socket variety of the joint. We'll see one by one. First, coming to the plane joint. The plane joint are those joints where there is a joint occur between flat articular surfaces of two bones. These joints permit only gliding variety of movement. Examples are like intercarpal joint, intermetacarpal joint, joint between the articular process of the adjacent metacarpals, the acromioclavicular joint, are the varieties of the plane joint. The second variety is the hinge, which is also known as the gingivalis joint. The joints having fully shaped articular surfaces articulate with each other. The movement is permitted in one plane around transverse axis, like a hinge of a door. And it stops here. This is the hinge of a door. Similar structure here. This is the example where trochlea of the humerus articulates with the trochlear notch of the ulna to make the humero-ulnar part of the elbow joint. This is a variety of the hinge. The next variety is the pivot joint or a trochoid joint. The articular surfaces of one bone is rounded, pivot-like, which fits into the osteoligamentous ring of the other bone. You can just observe here. So, the articular surface of one bone fits into a partly bony, partly fibrous structure, a ring, so that the bone fits into it. Now, these permit a rotational movement around a vertical axis. The axis will be vertical here and they produce a rotatory movement. So example, superior radial nerve joint, sternoaxial, atlantoaxial joint. So these are the examples for the pivot joint. Condylar joint, a distinct convex condyles of one bone articulates with the reciprocally concave articular surface of the other. So you can just observe here, condyle of the femur articulating with the upper surface of the condyles of the tibia. The upper surface of the condyle of tibia is concave, whereas condyles are convex. Such joint is called as the condylar joint. Now these permit movement in two directions. So like there will be two axes, a transverse axis and the anterior posterior axis. Around two direction they permit the movement. Ellipsoid joint. The elliptical convex surface of one bone articulate with the reciprocally concave surface of the other bone. You can just observe here. See, concave surface of one bone articulates with the convex surface of the other bone. You can just observe here. Lower surface of the radius and proximal surface of the proximal row of the carpal bone. Okay. Scaphoid lunate. So they make a joint, wrist joint. So ellipsoid joints show movement in two directions because there will be two axes. You can just observe it. One transverse axis, another anterior posterior axis. Hence, they can produce movement in two directions. The flexion and extension around the transverse axis, whereas abduction and adduction which takes place around the anterior posterior axis. The third movement is also possible here, that is circumduction. And circumduction is produced by the combination of the flexion, extension, abduction, and adduction. So all four together produces the circumduction. The example for the ellipsoid joint is the radiocarpal joint, metacarpophalangeal joint, atlanto-occipital joint. These are the examples for the ellipsoid variety of the joint. The next variety is the saddle joint. An articular surface of one bone fits into the saddle shaped articular surface of the another bone. Saddle shape means in one direction it is concave and on the other direction it is convex. So suppose anterior posteriorly convex and transversely it is concave. So such joint are called as the saddle joint. So again, like ellipsoid, these are also biaxial joint permitting the movement in two directions. So metacarpal joint. So you can just see this. So carpometacarpal joint are the examples for the saddle joint. The next variety, the very famous one, the ball and socket or spheroidal joint. Round globe-like articular surface of one bone fits into cup-shaped articular surface of the another bone, socket of the another bone. So like head of the femur into acetabular cavity. The movement occur in multiple axes. Examples like hip joint, shoulder joint. Now, based on the number of the articulating bone, the joints are of two types, simple joint and the compound joint. The simple joint where only two bones are articulating to make the joint, like interphalangeal joint. Whereas compound joint are those in which more than two bones involved in making the articulation, like elbow joint, ankle joint, knee joint. So these are all called as the compound joint. Now there is one more variety of the joint which is known as the complex joint, in which a joint cavity is divided completely or incompletely into two parts by an intra-articular disc. You can just observe here in the knee joint, there is a meniscus. Now, this meniscus divides the joint cavity into two parts, a part above the meniscus and part below the meniscus. So, such joint are called as the complex joint, like knee joint, temporomandibular joint. So, they are the complex joint. So, that much is related to the classification of the joints. Now let us see the blood supply of the joint. Circulus articularis vasculosus, a very articular network of the arteries, are considered to be the supply of any joint. Now these arteries, the branches of these arteries supply capsule, synovial membrane, epiphysis. The articular capsule is considered to be the avascular. Fibrous capsule, ligament, they have very poorly supplied by blood. The synovial membrane is richly supplied with the nerve supply. The synovial joint are rich in their nerve supply. The three types of fibers: sensory fibers, which are responsible for the pain; sensory fibers, which are responsible for the proprioceptive sensation; and autonomic fibers, which are vasomotor in function. So these are the three varieties of the fibers which provide nerve supply to the joint. The capsule are supplied by the encapsulated nerve endings, which are responsible for the proprioception, and also they are supplied by the free nerve endings, which are responsible for the pain. The ligaments supplied by the free nerve endings, which are responsible for the perception of pain. Synovial membrane are supplied by the sympathetic fibers, which are vasomotor, and also they are supplied with the free nerve ending for the pain. The articular cartilage do not have the nerve supply. The articular disc insensitive except their attached margin. So there is a law related to the nerve supply of the joint. The nerve supplying the joint also supply the muscles regulating the movement of the joint and the skin over it. Now, this law is known as the Hilton's law. There is a observation called as the Gardner's observation. The section of the capsule that become tense due to the contraction of the muscle group is innervated by a nerve that serves their antagonist muscle. This mechanism helps maintain the stability of the muscle. Now there is a formula called as the Last's formula, which states four consecutive spinal segments regulate the movement of each joint in the limb. The upper two segments regulate one movement and lower two regulate opposite movement. The joint, one segment distal in limb supplied by the centers, one segment lower in the spinal cord. Like if you take the hip joint, the segmental innervation is from the L2, L3, L4 and L5. L2, L3 is responsible for the flexion, whereas L4, L5 are responsible for the extension. Knee joint is supplied by the segments one lower than that of the hip joint, that is L3, L4, L5 and S1. Among them, L3, L4 are responsible for the extension, whereas L5, S1 for the flexion. Now, in relation to ankle, it is supplied by L4, L5, S1, S2. L4, L5 responsible for the dorsiflexion, whereas S1, S2 responsible for the plantar flexion. Now, let us see some relationship between Sandhi and other factors. First, let us see the relationship between Sandhi and dosha. Sushruta says, Sandhista Shleshma Sarvasandhi Samshleshat Sarvasandhi Anugraham Karoti. So, Sandhis are lubricated by the Shleshaka kapha, and this makes the Sandhi to move comfortably. Sandhi and Prakriti. Individual Prakriti have their effect on Sandhi. Ashtanga Hridayakara says, Krisha Dirghakritayah Sashabdaha Shabdhyana Medavi Prashitira Sandhi Bandhamanso Guda Snigdha Lishta Sandhi Asti Mamsaha. These are the references which we get in Ashtanga Hridaya. Persons of Vada Prakriti is Krisha and produces sound and movement. Whereas Pitta Prakriti person have Shithila Sandhi Bandhana and Mamsa. Whereas Kapha Prakriti person have Guda, Snigdha and Shithila Sandhi. Sandhi and Kala. One of the Kala among the seven Kala is the Shleshmadhara Kala. So regarding the Shleshmadhara Kala, Sushruta says, Chaturthi Shleshmadhara Sarva Sandhishu Pranabhritam Karoti. So it is considered as the prana for Sandhi. Shleshma is considered as the prana for the Sandhi. It binds the end together. It is essential for the proper function of the Sandhi. And he says, as how a wheel is properly oiled will produce its function very perfectly without any resistance. In the same way, the Shleshma which is present in the Sandhi will help the Sandhi to execute its action effectively. Sandhi and Sara. In Majjasara, it has been mentioned that Stula, Dirgha, Vritta Sandhya. So, Stula, Dirgha, and Vritta Sandhi is the characteristic feature of a person who have Majjasara. Sandhi and Srotas. Sandhi is the Mula of the Majjavaha Srotas again. Sandhi and Peshi. The Peshi covers the different structure of the body, such as the Sira, Snayu, Asti, Parva, and Sandhi, and impart strength to these structures, including the Sandhi. Sandhi and Snayu. There are four types of Snayu. One among them is the Prathanavati Snayu. And it has been mentioned, Pratanavatya Shakasu Sarvasandhishu Chapyata. So, Prathanavati Snayu is present in all the Sandhi. Sandhi will acquire their stability by various Snayu which are connected. So, Sushruta says, Evamema Sharire Yasmin Yavantaha Sandhya Smrta Snayubihi Bahubihi Baddha Tena Bharasaha. So, the Snayu which bind the Sandhi, which connect the Asti to establish the Sandhi, will provide stability to the Sandhi, and by this connection, the body get the ability to withstand the weight. Sandhi and Marma. 20 Marma in the body which are categorized under the Sandhi and a detailed description regarding the Sandhya Marma Vidya Lakshana is mentioned. Like in Ashtanga like Vastu Shuke Rivakirana, Rudecha Kuni Kanjata, Balachesta Shaya Shoshaha, Parva Shokasta Sandhi. So, and the list of the Sandhi Marma are Janu Marma, Purpara Marma, Simanta Marma, Adhipati Marma, Gulpa, Manibandha, Kukundara, Avarta, Krakatika. So these are the Sandhi Marma in the body. Now let us discuss the movements of the Sandhi. So there are 5 varieties of movement which are mentioned, and other than the 5 basic movement, Sushruta in the Nidhanasthana mentions 2 more varieties. So they are as follows: Utshepa, that is elevation; Apakshepa, depression; Akunchana, flexion; Prasarana, extension; Gamana, locomotion. And Sushruta Nidana, Nyaya Chandrika. So there are few more movement have been mentioned like Vivartana and Akshepana. So Vivartana refers to rolling or turning, whereas Akshepana refers to hyperextension. So now in the contemporary medicine, the movement of the joint can be categorized under two headings: active movement and the passive movement. The active movement include the first one, the general rotatory movement, which are of three types, like gliding or sliding movement, angular movement, and rotatory or circular. In gliding movement, one bone slips over the other. Example, like movement in a plane joint. Whereas angular movement, the movement in which the angle of the joint is increased or decreased, like as in flexion, extension, adduction, abduction, etc. Whereas rotatory or circular movement, two types of rotatory movement are seen, like rotation and circumference. The rotation is the movement of the body part around its own axis, whereas, like for example, medial and lateral rotation of the shoulder joint. Similarly, medial and lateral rotation of the hip joint. The circumduction, it is the combination of the four angular movement in a successive order, causing a circular movement of the distal free part, resulting in a cone-like movement of the body part, like the circumduction of the shoulder joint, hip joint, wrist joint. Now there are few special active movements. The few joints show some special active movement, like the inversion, eversion in the ankle, subtalar joint, protraction and retraction in the temporomandibular joint, elevation and depression again in the temporomandibular joint. So these are some special active movement which are seen in few of the joints. Now the second variety of the movement is the passive movement. These movements are produced by external force such as examining doctor. Example, gliding movement of the wrist, which a patient cannot perform by himself actively, but an examining doctor can produce it by careful manipulation of the wrist. In this image, we can see the one hand of the examiner is fixed, whereas with the other hand, he moves the wrist up and down, which produces the gliding moment of the wrist. Otherwise, as an individual, we cannot perform this movement. Now, let us move into the next topic under this heading, that is biomechanics. The biomechanics can be categorized under two headings, the static biomechanics and the dynamics. The statics is the study of the condition under which object remain in rest, whereas dynamics is the study of the condition under which the object move. So we are specifically concerned here under the dynamics. Again, dynamics is categorized under two headings, kinetics and kinematics. The kinematics again further divided into osteokinematics and the orthokinematics. The dynamics has two components, as I said, kinetics and the kinematics. The kinetics, it examines the various forces which act on the joint to execute a particular movement, whereas kinematics is a branch of biomechanics that describes the motion of the body without regard to the force that produces the movement. Coming to the detail of the kinetics, before the kinetics, as I said, it is the forces that act on body during the movement include the internal kinetics and the external kinetics. The internal kinetics are like muscle contraction, muscle lengthening, tension from the ligaments, whereas external include gravity, external load, external load and resistance. Kinematics, it also has the two components, osteokinematics and the arthrokinematics. The osteokinematics is the manner in which bone moves, whereas orthokinematics is the movement occurring between the joint surfaces. The osteokinematics include various movements of the joint, which we have already seen, like flexion, extension, hyperextension, abduction, adduction, medial and lateral rotation, pronation and supination, protraction, retraction, elevation, depression, inversion, eversion, plantar flexion, dorsiflexion, circumduction. So these are the manner in which the one bone move on over the other bone. Whereas orthokinematics is the movement occurring between the joint surfaces or how they fit together. This will help to improve the movement of the joint. One of the surface will be stable and other moves on it. The fundamental orthokinematics include roll, slide, and spin. Can you stop here? The first image which explains regarding the roll, where the lower bone in the image is a static bone, whereas the upper bone is the moving bone. So the bone which was earlier here, now gradually it is getting rolled. So now that movement is called as the roll movement. The second one is the slide. It is sliding forward here. It is not rolling, it is just sliding. The third one, where in its axis it is turning, it is spinning. So these are the three movements: roll, slide, and spin. Now the movement is measured by a method which is called as the range of motion. So range of motion, it is the amount of motion available to a joint within anatomic limit of the joint structure. It is determined by various factors like shape of the articular surface, capsule, ligaments, muscle bulk, the surrounding musculotendinous or bony structures. So these are the factors which determine the range of motion. Based on the range of motion, the joint can be categorized like hypermobile or hypomobile. If the joint is producing more than its normal limit, then it can be said as the hypermobile joint. If it is performing lesser than its normal limit, then it is called as the hypomobile joint. The measurement of the range of motion is done using a goniometer. There are three kinds of the goniometer available, like universal goniometer. So this one, it is a universal goniometer. So there are two varieties in it: the half goniometer and the full circle goniometer. The second one is the gravity dependent goniometer, also known as the inclinometer. Again, two types are there: the pendular goniometer. So this is the pendular goniometer, and this is the fluid goniometer. Then the third variety is the electrogoniometer. These are the different kinds of the goniometer which are available in the market. Coming to the applied anatomy, Sandhi Mukta Lakshana. There are different varieties of the Sandhi Mukti are present as explained in the Sushruta Nidana, like Vishta, Vishlishta, Vivartita, Avakshipta, Atik, Atikshipta, Tiriyakshipta. So these are the varieties of the Sandhi Muktis. Now, there are some diseases related to the Sandhi which has been documented, like Sandhigata Vata, Amavata, Vata Rakta, synostosis. So, in elderly, most of the sutures of the skull undergo ossification, leading to a rigid bony union. Now, that condition is called as the synostosis. You can just observe here. So, there is no sagittal suture. The skull of a child is resilient to bow to blow, but not so in adult. In adult, it becomes rigid like an eggshell and frequently splinters following an impact. So, in such cases, if impact occur, it just bursts. Periodontitis, inflammation and degeneration of the periodontal ligament, resulting in a condition called as the periodontitis. The teeth become loose and may fall off. Osteoarthritis, the articular surface or articular cartilage sustains damage as a result of a trauma, disease, or diminished synovial fluid. The articular surface make contact with one another, leading to weak wear and tear. Bone degeneration starts to occur in this case. The abnormal bone repair process lead to uneven and impaired articular surfaces, resulting in osteoarthritis associated with formation of the osteophytes. So that condition is called as the osteoarthritis. The next clinical condition is the rheumatoid arthritis. It is a chronic progressive inflammatory autoimmune disease involving synovial membrane. There will be hypertrophy and hyperplasia of the synovial cells. It causes erosion of the articular cartilage and growth of the granulation tissue that separate the bones and distorts the shape of the joint. Rheumatoid arthritis commonly affects the small joint of the hand and feet. Arthroplasty, the surgical repair or replacement of the joint, is called as the arthroplasty. The artificial ligament made up of the fibers which are coated with the plastic or polylactic acid. Dislocation, it is caused by lack of support of ligament or muscle and poor shape of the articular surface. Once dislocated, the articular surface no longer in normal anatomical relation. So in this X-ray image, you can see the dislocation, various kind of the dislocation which are which can be seen in this image. The commonly occurring dislocation are shoulder joint. So this is the dislocation of the shoulder joint, acromioclavicular joint, temporomandibular joint. So these are the very commonly dislocating joints. Thank you.